listen-only mode, and as a reminder, this event is being recorded for rebroadcast. We will be holding a Q&A session at the conclusion of today's presentation. We encourage you to submit written questions at any time during the presentation using the Q&A panel at the bottom right of your screen. Please type your question into the text field and hit send, and please keep the send to as all panelists. I would now like to introduce your presenters for today, Joe Toniolo and Dr. Raymond Huang. As a Senior Director of Health and Welfare Plans at U.S. Foods, Toniolo directs the strategy, implementation, administration, and communication of benefit programs for more than 22,000 benefit-eligible associates. With over 25 years of employee benefit experience, he plays a pivotal role in designing and implementing innovative benefit programs that enhance the overall health outcomes and lives of U.S. Foods employees and their family. Prior to U.S. Foods, Joe served as the manager of benefits at Sears Holding Corporation. Joe holds a Bachelor of Science in Finance from Northern Illinois University and an MBA from the Dominican University. Dr. Raymond Huang is Medical Director at Hinge Health. Dr. Huang is also a spine surgeon and Assistant Clinical Professor of Orthopedic Surgery at Tufts University School of Medicine. Dr. Huang earned his two engineering degrees from the Massachusetts Institute of Technology, his MD from Harvard Medical School, underwent residency training at the Harvard Combined Orthopedic Surgery Residency Program, and completed his fellowship in spine surgery at New England Baptist Hospital. He also holds an MBA from Harvard Business School. Dr. Huang, you now have the floor.
Thanks, Connie. Sorry you had to read our resumes like that. Hi, everyone. It's great to be with you today. In this first session, we'll discuss a few topics. First, data from the Hinge Health State of MSK Report 2022 on how musculoskeletal pain and mental health impact members across income, race, and geography, as well as strategies for employers to close health equity gaps in MSK care. And then I'll turn it over to Joe, who will discuss how U.S. Foods is creating a more holistic and seamless MSK experience for their members, as well as their clinical and financial MSK outcomes. And lastly, hopefully, we'll save some time at the end for some question and answer. Next slide, please. But first, I thought I would present a little bit of information about Hinge Health. We pioneered digital MSK care. Hinge Health was founded in 2015 and now has over 750 clients with 15 million covered lives. We now have more than 1,200 employees, 500 of whom are full-time professional clinical staff. Our founders experienced firsthand the shortcomings of MSK care with their own personal injuries and saw the opportunity to redefine best practice care by leveraging a complete care team, not just digitizing physical therapy. We are the only MSK solution using this approach, having been validated by U.S. universities across large-scale and long-term studies, including a 10,000 participant study, a one-year outcome study, and a third-party validated medical claims analysis. The experience we've gained from our over 750 clients and over 35 health plan partners has allowed us to deeply understand our members, quickly implement new solutions, and drive better outcomes for our members. We've received over $800 million in investment, which is great news for our customers, as it gives us staying power in today's challenging environment so we can continue innovating to enhance our platform. Here's just a quick example of how Hinge Health is leading the way by building the world's most patient-centered digital musculoskeletal clinic. It starts with our all-in-one app, which delivers our digital MSK clinic on a singular platform. This app is the portal to the full continuum of MSK care, all from the phone in your pocket or a tablet that we provide to the member. From this app, you can have a same-day video visit with your physical therapist, complete exercise therapy guided by a wearable sensor or computer vision, read educational articles, get encouraging support from your health coach, and much more. Since our app can be used either via a tablet or through a member's own device, this enables the member to access the app via cellular data when Wi-Fi isn't available. And now, building on that all-in-one experience, we recently announced that starting later this year, the full digital musculoskeletal clinic will also include women's pelvic health physical therapy. Hinge Health is very proud to lead the way in advancing health equity by making great pelvic health care designed for the unique MSK needs of women, easily accessible. Women's pelvic care is grossly underserved. 1 in 4 women have a pelvic floor disorder. It's very common, yet it's often overlooked. It takes a woman with a pelvic floor disorder, such as prolapse, pelvic pain, or incontinence, on average 6.5 years to see a provider. Pelvic floor disorders can occur at any age, but are most common during pregnancy, postpartum, and menopause. Access to proper care is limited because only about 7% of physical therapists are trained to treat pelvic floor disorders. With Hinge Health, you can schedule a pelvic floor physical therapist visit on your own time and get a customized care plan. If care escalation is needed, we have in-house urogynecologists available for consultation. As part of the Hinge Health platform, our care team can proactively identify high-risk members that would benefit from a pelvic health assessment. This can address the challenge of low awareness and help overcome any stigma so members can get the care they need earlier. So to begin our discussion today, I wanted to share some data on our new State of MSK Report 2022 on how musculoskeletal pain is impacted by mental health, job type, income, race, and geography. Next slide, please. Thanks. Our report is based on a proprietary analysis of the 2020 National Health Interview Survey data, representing over 252 million American adults, as well as other key data sources. Next slide, please. Just to set the stage for this discussion, as many of you know, I'm sure, musculoskeletal pain is exceedingly common, with 1 in 2 Americans suffering from an MSK condition in any given year. With longer life expectancy and an aging population, the expectation is that the prevalence of MSK pain will only continue to grow. Along with mental health, MSK pain is the leading cause of absenteeism and lost productivity. Given these trends, it's important for employers to help their workforce stay healthy and productive by offering inclusive and innovative care models to help address these needs. Here are some industries in the US with the highest prevalence of MSK pain. As you can see, essentially every job type is represented. We learned early on that MSK really spares no one. It impacts both blue-collar and white-collar workforces alike. Prolonging standing, repetitive motions at work, these can potentiate these symptoms. And sectors like mining, retail, healthcare, food services, manufacturing, and construction are particularly prone to MSK claims given the nature of the work. But office workers aren't spared either. Although professional services and administrative jobs aren't as physically strenuous, the sedentary daily routine of sitting in front of a computer is commonly correlated with back and joint pain. Next slide, please. Health inequities are particularly stark for individuals with chronic MSK and mental health issues. On the left here, you see a graph of household income against the prevalence of MSK pain with mental health comorbidities. You'll see that lower income populations are most affected by these conditions. 64% of those earning less than $30,000 report MSK pain. Even in the high income group of $90,000 or more, nearly 40% report MSK pain. However, lower income populations are most at risk since they tend to have the least access to best practice MSK care. Transportation challenges alone prevent a staggering 3.6 million Americans from receiving medical care each year. Roughly 1 in 5 patients reside in rural areas where they may have a drive of up to 45 minutes each way just to see a physical therapist. Similarly, there's a racial inequity in the prevalence of MSK pain and the disruptions that they cause in daily lives. The Black and Latinx populations with MSK pain and mental health conditions report the greatest disruption, though the figures are high across the board. Next slide, please. Clearly, MSK pain has a negative impact on quality of life, but it also has a substantial economic impact through both direct costs and lost productivity. First, treatment costs are increasing dramatically. Over the last decade, the cost associated with MSK claims has doubled in the US, even though the number of people with MSK conditions has remained relatively constant. This suggests that higher spend is not leading to better outcomes for Americans. Rising claims costs have been driven by more expensive treatments such as spinal fusions and expensive implants, as well as overuse of MRIs and the rise of outpatient pain centers. Second, in the past year, individuals with MSK pain missed more work days than the average employee. 8.2 days of work compared to 3.9 days. For people with both MSK and mental health needs, the number of workdays missed in the past year was 13 days. As a result, MSK Care consumes approximately 1/6 of employer-sponsored plan dollars, costing $600 billion to the US economy, far exceeding the costs of heart disease, cancer, and diabetes. Now, going back to the intersection of chronic MSK pain and mental health, there's a growing understanding in the medical community that chronic pain is strongly correlated with lifestyle, behavioral health, and emotional health factors such as lack of sleep, depression, stress, obesity, and diet. For example, many people with pain will say their pain is worse when they don't get exercise, when they sleep poorly, or when they're feeling stressed. But why is this? Now, I'm definitely oversimplifying a very complex interaction, but suffice it to say that many regions of the brain that process pain, otherwise known as the pain neural matrix, are also involved with processing things like fear, stress, executive function, memory, temperature, and body regulation. This helps explain why mental and behavioral health is tightly correlated with chronic pain. Nevertheless, 8 out of 10 people with chronic MSK pain and mental health needs are not engaged in exercise therapy, and 2 out of 5 aren't getting the necessary social and behavioral support to overcome their symptoms. This population is twice as likely to report poorer health than individuals with only chronic MSK pain, and 30% more likely to receive a prescription for opioids. All of this is to say that it is important to understand the connection between MSK pain and mental health in order to tackle either issue effectively. One trend that contributes to the increasing cost of MSK care is the wide geographic variability in MSK surgery. The map here highlights the variation in surgery rates and surgery costs across the country. For example, surgery rates in more rural areas like Oregon, Kentucky, and Montana are almost 3 times higher than in other states. As mentioned earlier, rural areas, in these areas, it's not uncommon for patients to have difficulty accessing a physical therapist, for example. It may not be practical to recommend physical therapy 3 times a week in such an environment, even if it's the most appropriate treatment. As a result, rural physicians may recommend surgery sooner for MSK conditions, and patients may be more interested in surgery given the challenges around accessing non-surgical care, even if surgery at that time isn't consistent with best practice care recommendations. We also see a substantial variance in surgery costs by state. For example, California, Alaska, and Wyoming had the highest costs for spinal surgery, almost 2.3 times higher than the lower cost states, Rhode Island, Tennessee, and Arkansas. I think we can all agree that zip code shouldn't determine the quality of care available to someone. And at Hinge Health, we provide the same high quality, consistent MSK care everywhere, whether members live in California, Kentucky, or Rhode Island. In this next section, I'll share strategies for employers to address these health equity gaps in MSK and mental health care, and what to consider for a holistic care approach. First, recommendation and strategy is zero out-of-pocket costs with a digital musculoskeletal clinic to reduce financial barriers. Given that low-income shift workers often find it challenging to take unpaid time off from work or pay high deductibles to get regular care, it's not surprising they had the least use of exercise therapy, often lack social and behavioral support, and have the highest use of opioids for pain relief. Next slide, please. By offering MSK care with zero out-of-pocket costs, Hinge Health's digital MSK clinic removes the financial barriers to best practice care. Hinge Health offers care along the entire spectrum of MSK treatment, from prevention and acute injuries to chronic MSK pain and surgery evaluation, as well as peri-surgical rehab, all without deductibles and at no cost to the member. Next slide, please. Second strategy is leverage comprehensive digital technology to help you overcome barriers to best practice MSK care. Digital care also bridges the rural and income divide, allowing members to access best practice integrated care at home. At Hinge Health, we pair our clinical team with a suite of advanced technology to reduce the barriers a member may face and facilitate sustained engagement. This begins with our mobile app. To access any and all parts of the Hinge Health program, a member only ever needs our singular app, which can be loaded onto any mobile device. Our app delivers personalized playlists of daily exercises and educational articles, as well as care team video appointments. Hinge Health provides free tablets and allows exercise therapy playlists to be downloaded, minimizing internet use. If a member doesn't have Wi-Fi, the app can be downloaded onto their personal device, delivering the same experience as the tablet. We also leverage computer vision motion tracking technology, which captures full body movement and allows us to deliver more complex exercises, particularly those that involve smaller joints like the fingers and the wrist. Next slide, please. Hinge Health also has the benefit of having Enzo, our wearable pain management device that is non-addictive and non-invasive, allowing members to start their exercise therapy sooner and overcome flares faster. This is particularly important for populations at higher risk of starting opioids for their pain. Enzo is an FDA-cleared and patented device that provides lasting pain relief by utilizing high-frequency impulse therapy rather than low-frequency pulses that are traditionally used by TENS units. Enzo is also wireless and integrated with our app, allowing our members to take control of their pain and get into their exercise program quickly. Enzo can provide lasting pain relief even when it's turned off, which can help avoid the need for drugs or surgery. It's light and small and fits easily under clothing, whether you're outside gardening or on your feet at work. Next slide, please. Third, it's important to leverage a complete care team to drive adherence and provide holistic support. Next slide. Recognizing that MSK pain and mental health needs are comorbid, meaning they often occur together, and therefore need to be treated holistically, benefits leaders and health plans can provide best practice care by surrounding their members with a complete care team that takes a more holistic approach to MSK care and goes beyond just physical therapy. At Hinge Health, each member is paired with a doctor of physical therapy who is focused on the member's physical recovery. The PT is responsible for customizing that member's care plan based on their pain and ability level and evolving that plan as the member progresses through the program. Their team also includes a board-certified health coach who supports and motivates the member to overcome the adherence challenges that traditionally limit the success of in-person physical therapy. Coaches help promote recovery with critical lifestyle and behavior changes that are key to MSK improvement. This is why all of our health coaches are trained in pain neuroscience and motivation to support our members, help them overcome life challenges, and keep them accountable. While the physical therapist is an expert at musculoskeletal care, health coaches have clinically proven interventions to get members to stick to their care plan. Hinge Health then layers on top of this education to help members with support of their health coach that can help break down the cycle of pain and depression, ultimately reducing pain levels and the disruption that they cause in their daily lives. Moreover, pairing members with one-on-one health coaches who understand their unique cultural beliefs can help them achieve their personal health goals within the context of their culture and ethnicity. Understanding not just the patient's logistical barriers to care, but also their social and familiar beliefs about what optimal care looks like is crucial to creating a more equitable healthcare system. And finally, the team also includes physicians and orthopedic surgeons who provide an expert medical opinion and decision support to members, especially when they are considering riskier interventions such as surgery or opioids. Finally, the fourth strategy is to enhance best practice care and health literacy through real-time data and education. Next slide. To help improve the delivery of best practice care, we have Hinge Connect, a two-way medical data exchange platform that connects us with the electronic medical records of over 1 million in-person providers. EMR information is typically available within 1 to 2 days of a provider entering it into their medical record system, which is much faster than the 4 to 8 weeks it takes to get that information from claims data. This data exchange allows us to quickly identify members who are escalating care so that we can provide timely interventions. This could involve delivering an Enzo device to help a member avoid taking opioids when a prescription for a pain medication is ordered, or could offer a free Hinge Health expert medical opinion when a member is referred to see a surgeon. The power of Hinge Connect is that it allows our care team to provide personalized interventions in near real time, which means we can intervene before a member commits to an inappropriate pathway that may be leading them towards unnecessary surgery or otherwise suboptimal outcomes. And the results reflect this. When we intervene at the right time, 80% of our members pursue a less costly or less invasive care option. Next slide, please. Finally, education plays a key role in MSK recovery and health literacy. Since chronic pain can be influenced by so many factors, it becomes critically important to address the member's behavioral health and lifestyle issues holistically. For example, weight overburdens the joints, and dietary preferences such as eating pro-inflammatory foods like sugar and carbohydrates also tend to increase joint inflammation. Stress increases cortisol in the body, which dampens the production of growth hormones that are critical for tissue repair. Depression and stress can also overexcite the nervous system and intensify the sensation of pain. When you combine these factors with physical inactivity, you get increased joint pain, inflammation, and stiffness. At Hinge Health, as part of our integrated care team, our one-on-one health coaches are paired with physical therapists to closely work with participants to help educate them and motivate them to make the important lifestyle changes like changing their mindset on pain, reducing stress, or adopting better diet and exercise regimens that will lead to better MSK outcomes. Now I'll hand it over to Joe, who's going to share more about US Foods' approach to holistic care.
Well, thanks, Doc. That was quite insightful. I learn something new every time I sit in on these things. So I'll keep coming and learn some more. So, all right, let's talk about what we're doing at US Foods. So there you go. So US Foods, we deliver food, right? And food stuff, right? So anywhere there's a restaurant or a hospital, school, health club, anywhere selling food, we're probably, their customer, they're our customer, I should say. We have it says 28,000 employees. It just looked this morning, we're at 29,000. So things are looking up for us for hiring and doing well. We have, if you talk about belly buttons, how many members we're covering, we have somewhere around 45,000. We're across the nation in 170 locations about. We're not in Hawaii, so can't go there, but we are in Alaska. We have a mix, so it's an interesting mix. It's about half blue collar, half white collar. Lots of drivers and selectors. I'll talk about that in a little bit. Average age, somewhere in the 45, age 45 range. Now, if you look at the bottom of the slide, it says great food made easy. And that's our tagline here. But in the benefits department, we like to say great benefits made easy. And you'll see that as we walk through our slides here, is we don't want hurdles. We don't want folks to, anything that'll prevent folks from engaging. So if we go to the next slide, we'll talk about our top cost driver, as Dr. Hoying said. MSK back 5-6 years ago when we started this, going down this path with Hinge, MSK was our top cost driver. And it's probably not surprising, shouldn't be surprising, because we have 7,500 or so truck drivers. We have another 5,000-6,000 warehouse workers. They're moving 40,000 pounds of product each and every day. So, as sales folks, we have 5,000-6,000 of those folks sitting in their cars, driving around. So, all those things that Doctor was talking about, that's us. So, we needed a solution, right? And all right, so we're as I mentioned, we're across 170 locations across the country. In office, distribution centers, out in the trucks, whatnot. And so, so they're out and about. So I can't capture them all in one spot, right? To do meetings. So how do we communicate to them? Well, that's another, challenge that we have, in that half of those folks don't receive a US Foods email. So we have to get creative. All right. So if we go on to the next page, we're going to talk about Joe's philosophy. We probably don't have enough time on Joe's philosophy, but we'll talk about Joe's philosophy on wellness and our benefits priorities here. And as I mentioned, we want solutions, alternatives that don't have hurdles, right? Because, it's our obligation as benefit geeks, as employers, to look after our associates and families. Don't forget the families, right? The other thing too is embrace innovation. There's a lot of cool things out there, and Hinge was one of the first cool things, right? And so they've developed over time, and you can see, all the new things that Doctor talked about, all is part of innovation, and so embrace it. The other thing, and I'm going to say this twice, I think, at the end of this, is shock the system. And that means, provide these innovative solutions and get creative on how you're going to communicate to your associates. We're doing podcasts, for instance, and doing some creative things to make folks pay attention, because otherwise it just becomes wallpaper, right? And have fun doing all this. That's the best part here. All right, let's go on to the next. We're going to talk about just philosophy and wellness. Just more philosophy. It keeps coming. It just doesn't end, right? So if we go back, like 10 years ago, we had like that traditional wellness, that health coach, the ones that called you, and they called me and I didn't answer the phone. And so how can I expect my own folks to engage if I'm not? So we had to rethink what wellness means. And so we started back in 2017 offering, we got into the point solution waters, and all of a sudden we started to see higher engagement. And I think what we learned is when people are ready to engage, when they have that life-changing experience, or there's just something that says, you know what, I'm done. I'm tired of doing it the traditional way. Let me try something else. And so, so that's how we all started here. And the solutions we want to provide a better quality of life. It's pretty simple, it's our responsibility, again, as employers, to put these alternatives, these opportunities, these solutions that employees are going to use. And it's more than just, hey, your back hurts, take a pill, come back, call me in the morning type of thing. But no, we want to try a better way of doing things, or a different way. And certainly I want to save on the bottom line, but we also want to save the associates' bottom line, right? Everybody gets a trophy here, and that's just it. It's a win-win here. And then the last item is access anywhere. As I mentioned, we have several point solutions, and we saw the engagement. And so just same with Hinge, needed something different, and something where you can do it wherever you want. It's not just have to make that doctor's appointment, take off work, and go in. So with Hinge, that satisfied that one requirement. All right, let's go on to the next page, please. And so, okay, back in 2017, we, as I said, started to provide these alternatives to the traditional method of in-person physical therapy. That's expensive. There's a hurdle, right? And I think we heard the doctor talk about that. It costs money, and so some people don't want to spend that money. So let's get rid of that hurdle and make it free. And so, and people, and then they don't have to take off at work, and they can do this wherever they can do it. So that's making it flexible, right? So you can do it on your break if you're, working in an office, or if you're out in the car, you can take time during lunch. We just don't want to do it while we're driving, right? That's the key here. Then and the other thing too is Hinge opened our eyes, my eyes, and you'll see a stat coming up in a little bit here on how it's related to mental health, how MSK is related to mental health. Wasn't even thinking about that, right? And so Hinge has that clinical care team that Dr. Wayne talked about, with doctors, therapists, health coaches, and all those other things. So they're there to support the needs of your associates. And it's not just the PT doing the actual exercises, right? And the last item just to throw out there is the technology. You saw that from wearing those sensors, using your phone or the tablet, whatever works for you, and it's non-invasive. So it's just an additional way to an alternative to PT. So, all right, let's go on to the next one. And then after we launched back in, like I said, in 17, we did a couple of other point solutions. So we started to learn what works with our associates and our culture. Hinge actually got really creative as we started building these communication pieces, postcards, posters, mailers, text, emails. You all have done this thing, right? But they put different URLs on each one, and we saw that folks were entering or signing up for the majority, not the majority, but the higher amount was through postcards. And so we learned going forward, keep it simple, right? A few words, because you got half a chance if somebody has to open up an envelope and start reading. Do it on the postcard, and it's a quick hit, and you got them there. So yeah, and we started getting, as I said before, with the health when we had our traditional health and wellness coach and all that stuff, didn't have the engagement. Started getting really good engagement here. So all right, let's on the next page here. Let's talk about some of the data, some of the stats. If we go to the next page, you're going to see here's engagement per participant on average. And so they're doing 9.3, right? Approximately 9.3. So what this means is it's broken down into three sections. How many therapy sessions are they doing? So it's about one every other day. So about 3 during the week, right? Approximately. And then you have, they're reading, they're going out and wanting to learn more. Now they're interested, you got them. They want to be better. And so whatever it takes, they want to read more and learn more. And then the last piece is that care team that we talked about earlier. So over 5 interactions during the week. I think that's tremendous, right? And so all positive stuff here, from doing the therapies to actually talking to somebody. All right, next slide, and we have this is survey data. So Hinge will survey their customers, their patients, each month on a number of things, and this is one of them, and this is on the pain reduction. So there's 57 for us, 57% reduction after that first 12 weeks or 3 months participating in the Hinge program. And kind of I'm not a doctor, and the doctor could certainly weigh in, but I'm told that, if by taking opioids, you get about a 15% pain reduction. So there you have it, the power of working in the Hinge system here. All right, next slide. And this is the likelihood of having surgery. I say this is the money slide, right? This is really, if you get somebody to not have to have surgery, there's a savings there, and in our case, it's 66% reduction. And if you talk ROI, because that's always the big thing, right? We're in the 3.5, 3.9 to 1 ROI. So all the good stuff that we're experiencing. Next slide. And this is that surprising one that I was talking about. And again, I just didn't even think about this. I'm thinking about getting folks back to work, doing, being productive, doing the things they want to do, which may include, we don't have to do housework now. So I don't know. I'm sorry if that's the case, but their depression, anxiety decreased, and it's tied to it directly. And again, we just heard that what doctor was talking about. So all positive stuff there. And let's go down to the next slide there. Yeah. And then more survey data here. It's the absenteeism, presenteeism, the productivity piece, and we're seeing a reduction of 39% for us. And so, at some point, I want to somehow marry up like our STD data or our FMLA data. I've been wanting to do this for 20 something years. It's just so hard, but at least we have a point here on showing how this does work, and folks are reporting that their absenteeism, yeah, they're going back to work, and they just feel good when they do go back to work and being productive. And then on the next, I think this might. Oh, the testimonials. That's right. So, testimonials sell. So once you get going in the communications, and you start getting the folks signing up and doing this, the testimonials is what resonates the most, I think. You could read the slide here. I actually just had somebody email me, and I never received an email. It usually comes through Hinge. They emailed me directly, and that person said that they haven't golfed in like 10 years. They're finally golfing again. And this person here, they're swimming, right? The things they love to do. They're golfing, swimming, doing that housework as I mentioned. Maybe doing the triple 1D. I don't know if this person's a diver, but it says she likes to swim, and then she dove in. So this is all fun stuff. And this is why, by the way, I come to work and my team comes to work, is we want to hear about this, right? And it's not about, somebody forgot to enroll. It's this. This is why we come, and we owe it to our associates and their families to provide alternatives to traditional way of doing things here. So, all right, let's go to the last slide. I think there's a last slide. And this is, we're a food company, right? So you sit through a lot of these programs and webinars, you go to conferences, you can't remember all this stuff. You really can't. So I always say, take a takeout, right? It's a takeout food company. Don't finish your plate. Take it home. Well, I want you to take something back here. And I would say, you can read the slide. I said it before, shock the system, right? That way you're going to try something new, shock the system and put, you know what? And if you're a little tentative on trying to, wanting to roll something out, talk to your Hinge folks. Say, hey, let's do a pilot. Let's take a section of our population and let's see how it works. Dip your toe in and see if how it resonates and get some of those testimonials, right? All right, back to the moderator. I don't know if that's Connie and Marina, whoever wants to take over. Joe, be quiet now.
Thank you, gentlemen. And once again, ladies and gentlemen, if you would like to submit a question, you can do so through the Q&A panel on the lower right-hand side of your screen. And give me just one moment here. And we will get the gentleman.
While we're waiting, I would ask the doctor. I saw you were talking about. I exercise regularly, but I do like my sugar and my sweets. Is that okay? Right? Can I still have that? Because you said it sounds like if you're not doing anything, then you start to get joint pain and all that bad stuff.
Yeah, Joe, that is a great question, and I think it's a complex answer. It boils down to taking an assessment of the kinds of risk factors you have that might potentially promote or exacerbate the pain that you have. And the dietary aspect is a real one. These are things that have been shown in studies to affect the inflammation of your joints. But I think it's like anything else in life. It's about taking balancing the risks and benefits. Obviously, I enjoy eating. I certainly would hate to cut out any specific thing from my diet forever and permanently. But it's about understanding and making decisions with the information needed to be able to understand what the impact of your decision is. So if you're struggling with back pain or knee pain, and there are some improvements you can make along within your sort of diet and the kinds of things you eat, then that might provide some benefit in the broad sort of complex set of things that can affect your pain. That's one thing you can do to make a measurable amount of improvement. So I think it's more about understanding that the choices we make kind of throughout our lives can have an impact on our MSK pain, and then taking that information and making decisions about, for ourselves that make sense. So I would say no need to eradicate all the sugars from your diet, but just understanding what that impact could be on your MSK pain is
Makes
important.
sense. Yeah. Thanks, man.
Joe, I'll also say that I share your enthusiasm and maybe surprise seeing the mental health data that's associated with the improvement in pain. I think that is the one thing that really, for me, highlights this complex interplay between the structural things, the arthritis in your joint, and this sort of harder to see, maybe not as well understood thing around our behavioral health, our lifestyle, our mental health. The fact that by improving your pain, we're able to see these dramatic improvements in anxiety and depression is both really, to me, telling of how important it is to address both the mental health and the physical health, to really address either the mental health or the physical health. They really go hand in hand.
Yep.
And I that was one of the most impressive things that I took away from this holistic approach that Hinge Health is taking.
Yeah, it was surprising when I saw the numbers. I see we have some questions in the.
Yes, sir.
All right.
Our first question. What have been some of your key success factors in communicating Hinge as a benefit?
Yeah, you know, and I didn't say it at the beginning, so we're about 80% males. It's just the nature of the industry. But I'm told that we don't pay attention very well, right? And so when I saw the engagement, that was, I think, a success. And you look at them, I'm looking this way because I have some of my own stats that I pulled up here from program to date from October of 2017 to June 22, June of 22. 2,500, almost 2,600 folks have gone through the program, or that they accepted, and 2,000, 2,100 almost engaged. And um, so I think and I say something about communication here. Um, getting it's because we're across the country. We have wellness coaches or wellness champs, as we call them, or HR. You need to get to them first, right? Before you roll anything out, to let them know this is coming, and then send out some of the communications, because when they start to get an email from Hinge, they're saying, is this spam? Right? So somehow you have to, head that off ahead of time. And so we have our benefit administrator. We use a light, and so they know the benefits center. And so when information comes from there, they know that it's legit. So those are some of the successes, I guess. And then the other thing too is know your culture. Know who you're speaking to. We need to get information to the home, right? So let the family, let the decision makers see this. That's really important. And we also know that less is more. We have a bunch of other point solutions, and if you're going to inundate people with hinge, 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 they're not going to look at it at some point, right? Because they're getting stuff from our diabetes and COEs and Fidel, 401k and other providers, and so just be cautious on how you and how much you do that. So those are some of the techniques we used and have been successful.
Thank you. Our next question. Can you inform how the digital care can be accessed?
Is that, I think that probably for you, Doc.
Yeah, I can speak to that. So um, I'm not sure if this question is referring to how to enroll in the program, but I can cover that initially. So we at Hinge Health are, we want to make the enrollment process easy, but obviously also want to make it safe. And so at the time of enrollment, the member will be asked to fill out a relatively short but comprehensive intake form, essentially, to ensure that members are appropriate for the program, and also to assign them to the most appropriate program based on the nature of their pain, duration, body part, etc. We want to make sure that members who may have conditions that would preclude them from safe participation are obviously directed to the appropriate medical care. That's very, very rare. The primary focus of that intake form is really to get a good sense for what that member's pain is like, help inform the care team going into that initial interaction about what the member is looking to achieve, and the kinds of things to start focusing on with their overall sort of holistic picture. And once that's done, the member is assigned to a program, they're assigned a care team. They will have an initial telephone conversation with their health coach to really get to know one another and sort of help establish a relationship where they can build the trust and that sort of mutual sort of trust in each other, I suppose is the best way to put it, to have like an honest conversation, to be able to talk about potentially, very meaningful and potentially sensitive topics that will really have an important impact on their recovery. And then after that, they can schedule PT video visits to start their exercise program. And at that point, their program begins, and there will be customizations, and the program will evolve as they improve and progress through various levels.
And just to add on to that, we have several other point solutions, and so Hinge is part of our ecosystem. And so, as Doctor was saying, they're getting an understanding of the person. Let's say they have diabetes, and we have 2 programs for that. They'll refer, right? Or, hey, you know what? You need a second opinion here. We have a second opinion provider. Let's send them that way. And maybe ultimately it is surgery. But you want to do what's right. Right? You're not just going to say, no, go away. It's no, but here's your other things before. And I think that's really important when you're working with Hinge or any of your point solutions, that they're all talking to each other. So it's really important.
Yeah, that's a great point, Joe. I think that one of the things we see coming out of these health coach and member interactions is because they have this trust, they have this sort of therapeutic alliance. These conversations start building a higher level of understanding that they may not necessarily have by a 15-minute visit with their primary care physician. And we absolutely want to be able to leverage the additional resources that are available to our members, including other point solutions. And in certain cases, like Joe said, surgery is appropriate, and we want to get them hooked up with a surgeon. Sometimes they need to see an endocrinologist in person to be able to actually be more aggressively treating their diabetes. All of these things we can really suss out with this longitudinal sort of high touch coach interaction and care team interaction.
Thank you. Okay, our next question is for Joe. Do you use the zero copay, or excuse me, zero out-of-pocket cost for members, or use an incentive strategy with your members?
So there's no cost. We don't incent, and we still got 2,600 people, to go through this thing in 5 years. Just certainly talk to your legal folks, because when you get into high deductible plans with HSAs, etc., we're still waiving all out of pockets deductibles even for that group. But certainly talk, what's your risk tolerance or your tolerance, and doing those sorts of things with the high deductible plan.
All right, thank you. And why did you choose to prioritize an MSK benefit over other condition-specific benefit options?
That's a great question. So, as I mentioned, we had 2 other. So we looked at our data, and the 4 or 5 that Dr. Hoying had up there were exactly that, right? MSK, cancer, heart stuff, and diabetes. And so we went after diabetes first. And so we launched 2 different programs for that. And then MSK was next. And Hinge was the first. They were the pioneers here. And there wasn't anything out there. There's some physical therapy type things, but not a point solution. And so when that came out, we said, let's try this and let's do a pilot. We did a pilot. And it went so fast, we had to open this up. I mean, we had so many people, and they're asking, "How come I don't hear about this?" And so, so it was very successful. I didn't think it would be, just because of the nature of our engagements from the past. We had high engagement in our 2 diabetes programs. It just moved on, and so we found that when there's, and I said this earlier, when somebody has a life-defining moment, a child dies, a spouse passes away, you can't walk upstairs anymore. You can't throw the ball, you can't do the housework, right? They engage. And so hopefully I answered that.
Thank you.
Mhm.
Our next question, what would your advice be to anyone that is implementing Hinge for the first time?
Yeah, get creative. Like I said, it's all in that marketing. Make sure everybody knows about it that should. Um, and I'm hoping your folks best. Hinge will work with you in uh, creating or editing the communications. And so, whatever makes sense for you, that's going to resonate, right? And maybe you guys sit all behind a computer, so maybe it's text and emails, and that's going to resonate. So do what makes sense, and then also make sure that they're aware of any other solutions. You may have an advocate. So, we have a health advocate with our TPA. Make sure that they're tied together so that, if somebody goes to your health advocate, they can refer. And same thing, as I mentioned before, that Hinge can also refer in.
Thank you. And next question is for Dr. Huang. Are your expert medical opinion physicians and surgeons staffed by Hinge Health?
Yeah, great question. They are. Our physicians and surgeons are all employees of Hinge Health, and this was an intentional decision. In looking at traditional musculoskeletal care, unfortunately, I think it's fair to say that most MSK physicians do not emphasize these other factors that we've talked about today, that we know affect MSK pain, such as the lifestyle factors and the behavioral factors and the mental health factors. I think there's a recognition, but it just isn't something that they are either trained to do or frankly have time to do. So finding physicians and surgeons who share our view, our approach is very challenging. And because our approach to MSK care is fairly unique, at least relative to the traditional healthcare setting, and even within the digital MSK market, being employees of Hinge Health, this allows us to ensure that our members are getting a consistent experience, a consistently holistic experience, whether they're in our chronic program and having exercise therapy, or if they're seeing and speaking to our physicians through an expert medical opinion.
Thank you. And probably our last question for today for Joe. What has been the biggest benefit about Hinge, or excuse me, the biggest benefit of adding Hinge Health as a benefit?
Yeah, no, it's a good question, and you don't know what you don't know, right? And when we launched it, we were cautious. We were new at the point solution game, and we had engagement, and so we offered an alternative. And I said that in the presentation. I just can't stress it enough. If they don't engage and they don't enroll and do anything, you're still back to the traditional way of doing things, right? So, I would say by having this, it's an option. It's a low cost. It's no hurdle or easy. All the things that doctor said. I mean, there's no cost to them. There's a savings to us, as you saw in some of the data. And there's a bunch of other stats that just trying to give you the ones right up front, and then learning how to communicate better. And that had nothing to do with the whole PT piece of it, but they helped us understand our population. And so, we learn from them, they learn from us, I think is it was a good, happy family here.
All right. Well, thank you everyone for joining us today. We'll give you a few minutes back and end a little bit early. And ladies and gentlemen, that does conclude today's webinar. You may now disconnect your lines.